Bilal Mohammed, acting PR, Tamale Teaching Hospital. In relation to the release that you saw on various media platforms, both social and traditional media platforms, regarding the threat to withdraw service by a section of staff of Tamale Teaching Hospital who work at the COVID-19 isolation and treatment centers. Management had a series of meetings with the staff yesterday, and the meeting was fruitful to the extent that the intended industrial action was suspended. And currently, as we speak, the staff are on duty and working. The issues had to do with vaccination against COVID-19 and payment of insurance claims to staff who were infected with the coronavirus disease. And lastly, it also had to do with the payment of the 50% basic salary allowance for frontline health staff. For the vaccine, an explanation was given, and the people took that in good faith, because the explanation was that as an institution, we did not have control over the procurement and distribution of the vaccine. But we had assurance from the Ministry of Health that when they receive the next consignment of vaccines, TTH would receive its share of the vaccines that they will be receiving. And for that reason, we were just supposed to keep patience and wait. Whenever the next consignment arrives in the country, we will get our quota and staff will receive the jabs. Immediately we receive our quota from the Ministry of Health. There's a process that we need to go through for the claims to be made, which processes we had started. I think there was some communication gap, information flow that resulted in them threatening to embark on the industrial action. When the issues were actually explained to them and information given them, they were satisfied with whatever explanations that came and immediately suspended their industrial action. For that reason, they are currently at post and working. But the issues that were raised in the, so to speak, anonymous release were issues that had been discussed in the past within the hospital amongst the staff who work at the COVID-19 treatment center. And for that reason, when we got wind of that information, we did not want to easily or simply discredit that. That was the reason we had to, even though nobody owned up for the authorship of that document, but we still believed that it was worth engaging with the staff there in order to explain the issues, so much so that we are able to forestall any future occurrences that may happen as a result of disinformation or miscommunication.